Some are born with an inbuilt knowledge of what one's body needs. Others are easily misguided and led by fashion, popularity, and peer pressure into things that should be avoided. There is also the body's willingness or otherwise to partake in harmful substances. In my case, my body could not tolerate chemicals or anything that affected the brain. This was guided by my keen desire for knowledge and making my intelligence number one. The lessons learned are that what we do when we are young has an impact on aging and on what diseases and handicaps we will face as the years pile up. Good body maintenance is about avoiding anything toxic, and that includes even dangerous rides at carnivals. The latest fad is to take rides on vehicles that cause a drop and sudden stop, as in some crazy fairground roller coaster adventures. Watching one of these recently, it was hard for me to believe that people not only put their own bodies at risk but that of their children in the name of having fun. The human brain is soft and very easily damaged. The body warns of impending danger through the adrenaline glands and the sensation that many find addictive. As adrenaline flows, it increases the heart rate and provides us with a flight or fight experience. In other words, it prepares for recovery from harm. As the body jerks into a sudden stop, the cranium and brain collide. This causes a degree of bruising and can even result in death or paralysis. But that doesn't have to happen immediately, as a delayed response may see the effects of concussion several hours or even a day after the event. Headaches, nausea, dizziness, memory problems, irritability, as well as balance and sleeping difficulties may follow. Look at these symptoms and compare them to those of Alzheimer's or dementia patients. With the latter, there are huge changes in brain functions that include memory loss. While there is no proven correlation to support the linking of the two, it doesn't mean it is not correct. Drugs also affect the brain, and taking pills on a regular basis may also be leading to the onset of Alzheimer's or dementia. While there are no studies to prove this is the case, it's still a matter of common sense. If one is looking for a fitness regime, then start with the brain and all other things will surely follow. It has the ability to tell us when we are going wrong. Drugs, on the other hand, interfere with that side of nature. We educate the brain by what we do to our bodies. If we stuff ourselves with things like sweets and alcohol and tell it that the odd adrenaline rush is okay, then changes in that vital organ will impel us to take more of it. Norma Holt has knowledge that enables her to understand many issues. Politics, health, social and behavioral problems are usually on her list for discussion, as well as anything to do with the spirit of the universe and reincarnation, which she experienced. She is happy to hear from any of her readers. Healthcare organizations can employ different healthcare methods for quality improvement. Since healthcare is not a simple phenomenon, industries find it hard to adopt the controls and standardization of quality improvement methods. However, general methods that define quality, grow improvement measures and identify variation through PDSA cycles and control charts have been successful in the application of healthcare processes. Let's take a look at some healthcare quality improvement methods. Number 1, facilitate adoption. It's not enough to introduce new ideas to clinicians and discuss case studies. The reason is that it won't motivate them to follow the improvement initiatives. It's better to learn the quality improvement theory via hands-on improvement work. In other words, it's applied to the real clinical setting. Also, identifying important areas for clinicians and develop the platform for betterment can help make the adoption much easier. Number 2, defining quality and reaching an agreement. If we agree on what quality means in a certain context, we can establish the measures and then collect data based on them. Also, the Institute of Medicine made a quality framework based on 6 aims for the systems for healthcare. However, the most important of them is the one that is patient-oriented. In other words, it stresses the provision of care based on the values and needs of an individual patient. Also, it ensures that the clinical decisions are made based on the patient's values. The definition of quality refers to what the patient thinks is important. It's to make sure that the patient is getting the best care possible for their illness. Number 3, improvement and accountability. Both data and measurement make the backbone for quality improvement. This is the point where it's difficult to take care of the matters associated with healthcare. Typically, when it comes to quality improvement methods, clinicians think that they involve performance measures that require accountability. However, it's important to remember the difference between accountability measures and improvement measures. Typically, the accountability measures are processed to get percentages. An accountability measure, for instance, gathers data about the number of patients who had to hang on for over 30 minutes for their turn. And then management is asked to keep the waiting time below half an hour. So, the improvement measure figures out the actual waiting period in minutes in order to find out the system performance and improve it. Number 4. PDSA Cycles and Quality Improvement Framework. For healthcare quality improvement, many frameworks are used. The DMAIC model of Six Sigma Lean methodology. The model of improvement was designed by the API in 1987. PDSA cycles are the most important part of healthcare quality improvement. Given below is the explanation of the PDSA cycles. Plan to study Act Number 5 Variation in Data. With a deeper insight into the model for improvement, the plan can help you achieve your improvement goal. Some of this insight comes from getting to know the variation in data and its causes. Also, healthcare processes include two types of variations, intended and unintended. The intended variation refers to do something in a different way on purpose. And this defines patient-oriented care. On the other hand, unintended variation happens when many clinicians prescribe different types of antibiotics for a problem at hand regardless of the rationale of the variation. And an out-of-habit or a free-of-thought variation is called an unintended variation. So, this was a description of 5 healthcare quality methods. MEDESUN Healthcare Solutions can be a great resource if you are looking for medical coding training in Hyderabad.